All right, Harland Holman here with a family medicine clerkship and excited for our special guest today. Natalie, can you introduce yourself?
Hi, everyone. I'm Natalie. I am just about to start residency at Sparrow's Family Medicine program.
All right, Natalie, I'm going to have you take yourself back to the time where you decided to do family medicine. Can you try and remember that and give a few details about like what went into that decision?
I'd always kind of known since applying medicine I was interested in family. It just fit my personality, it fit my interests in long-term relationships and getting to really empower people to live the way they wanted. Um, but when you do your rotations, you're kind of pulled and torn, especially as family med people. We love a little bit of everything. And I did my ICU rotation and I thought, oh, I love this. I love being the best, like the last resort. This is so much fun. I love giving such intense care to people. I'm really worried. What if I want this more than family medicine? And my immediate next rotation was family medicine. And I got into the clinic and I texted my dad that night. I said, Dad, I want to do family medicine. There's just no doubt. I just had what I thought was the most fun rotation I could have. And then I came to family and it just like in my being felt right. I felt like it was indescribable. I wanted to be here talking to these people about the minutia of their life and I wanted to form those relationships and I wanted to be the person they could go to first and not just making them build trust in the specialty, not just, oh, I need a referral, but really being that patient-centered medical home for them. And it was better than anything I'd experienced before.
That is really awesome because I talk to students that maybe are kind of sitting the fence between OB and family medicine or sports med, going into ortho or family medicine. But I mean, that interest in ICU too. I think there's like no specialty that you can also be interested in that would say that you also can't do family medicine because like you said, it's so broad and you can still find your niche. And if you want to do ICU, you could find a hospital somewhere there you could do family medicine outpatient and ICU if you wanted to. So I appreciate that reflection, which is interesting because it's maybe not the typical one, but it just shows that, we have a wide of interest in our group of people that are being family doctors. So that was
I
really
think,
cool.
yeah, and some people will kind of write family off as passing the buck. And I think in ICU, you can't pass the buck. And I realized that it is a choice if you want to pass the buck in family medicine, but you can elect to have the buck stop here. And I
Yeah.
think seeing the people at the residency who said the buck stops here, I was like, oh, I love this. Medicine can and should be this in many ways. I
Mhm.
mean, certainly we have partners who do amazing specialty work, but it just was really inspiring.
Right. Oh, that's great. Well, thank you.